Americans for 100 years collectively, actually now more, let's say.
Maybe it's 150.
That's right.
Yeah, buying stuff.
Incredibly impressive. And, you know, I collectively even longer engaged in the public policy process. And I don't know about you, but I've never seen anything like this in more than 3 decades of involvement. And I was a reporter for a long time, so I kind of needed to see for myself what these town hall meetings were about. And I had an opportunity to speak from Utah, Colorado with Congressman Bachman, to Ohio, to Louisiana, to Virginia, and across the board. I mean, there's nobody organizing these folks. They are coming out because they are scared about the future of this country. Healthcare is a lightning rod issue, but it's a lightning rod about government control over their lives, the economy, and they are engaged in the details in a way that I have never seen. I was involved in the 1994 Clinton care debate and helping the American people understand what was in that legislation. It took many more months for people to find out because we didn't have the internet. People are finding out about what's in these bills, and as you all see at town hall meetings, people quote from the bills. You know, they're taking times away from their lives to tell us what's in the bills, and to clearly see that they're not being fooled by the rhetoric. And to have leaders in Congress calling the American people names because they're concerned about this country is something I've never seen before. It's absolutely shocking. And to disregard them. Apparently the 3 major networks gave only passing coverage to the incredible rally on the Mall on Saturday. I had a chance to come down here. And it was unbelievable. You couldn't move. I think Fox News is reporting today that there were 1.7 million people. And what did they say? 1/10 of thousands. It was astonishing, and you didn't see any 2 signs alike. I talked to somebody who'd driven here from Washington State. I talked to another lady who organized a caravan from Ohio for people to come back here. Some lady who'd flown in that morning because she wanted to be here and have her presence heard. So this is a grassroots movement like I've never seen before. I had a chance to speak at a town hall meeting in Louisiana, also in Lafayette. It was in a public library with a big auditorium, and it was a 4:30 town hall meeting. It was filled at 1 o'clock. 2 overflow rooms were filled. The fire marshal finally closed the building. People stood out in a driving rainstorm to be able to catch the Senator Dinner on their way out so they could have their voices heard. You tell me that this is going to be disregarded. Like, the American people are going to have their voices heard. It's extraordinary. Because they're focused on details, the president may have gotten the bump from his speech on Wednesday night, but people are going to focus on the details. They're asking the critical questions. Does this really hold together? Can you really spend another $1 trillion and save money on health care? Can you really cover however many more million of the uninsured you cover by cuts to Medicare when the Congress has not been able to allow 7 rules that the Bush administration put into effect to stop some of the documented fraud in the Medicaid program? The Office of Inspector General of Health and Human Services and the Government Accountability Office have documented fraud, including Medicaid money being used to drive people to shop for party dresses and go to bingo games. And they can't stop it. So where on earth are they going to come up with $600, $900 billion to pay for health reform in any way that's realistic and reasonable? So what my takeaway from the town hall meetings is that I think that the American people will be scared by any big bill. They do not want to see a 1,000-page bill from Democrats, Republicans, or anybody else. They want to be engaged in the process, just as Dr. Burgess said. They want to be aware of what's being proposed, and I think a series of targeted solutions, they may be combined in the same bill, but giving people a sense of what do you need to do, and looking at those things that there is sort of a low-hanging fruit. You know, as Mark said, buying across state lines isn't the only solution, but it's part of the problem. We clearly, I mean, wasn't malpractice reform one of the biggest applause lines when you talked about it in a town hall meeting? That targeting the uninsured, you know, people have realized that when you break down the number of uninsured, it's not one solution for everybody. We've got to figure out how to target that solution. Because American people want that problem solved, but it doesn't mean that we have to change the system for 300 million Americans in order to cover the uninsured. And also, I think pre-existing conditions absolutely has to be dealt with. That's a huge hot button issue. But I really believe that a series of targeted steps, giving the American people an opportunity to be involved in this conversation, is going to be much more successful than any alternative 1,000-page bill.